wananchi na masharti ambayo tumeweka tu kwa ndio iwe hapo, ndio kuwe, sababu tuseme nchi iko na hii masharti ya kuweka barakoa. Hiyo sio kitu ya maana. Kitu ya maana ni vile ni lazima tuokoe maisha ya watu, na kwa sababu hiyo ndio ile kitu muhimu. Tukiona ya kwamba si lazima watu waweke mabarakoa ndio hiyo ifanyike, tunaweza kuzitoa hiyo masharti. Vile vile siwezi kukueleza leo hii niseme ya kwamba hakuna ati haitarudi tena. Siwezi kukueleza ati niseme ati mwezi wa Mei ama Juni hatutaregea tena kuanza kuweka barakoa kila pahali. Hiyo ni mambo ya kesho. Maombi yetu ni tusifike hapo, na njia ya sisi kuzuia kufika hapo ni mambo ya kuchanjwa. Kwa hivyo sijui kama maswali yako yote nimerudisha, lakini ikiwa iko moja ambayo nimesahau, pengine utasema. On the issue of SARA, and we are the first country to relax these measures. As a matter of fact, a few countries have relaxed measures. South Africa, for example, has relaxed a few measures, not to the extent that we have. But throughout the management of COVID-19 in this country, we have made decisions on the basis of our own science and our own observation of the evidence that we have across the country. And I think that the evidence we have currently is that it is possible for us to take the kind of measures that we have. And I think that to combine your question, and I think another question that was the Swahili question as well, is what measures have we taken to ensure that if the disease burden, if an outbreak comes again, then we are ready. Well, as you know, we have been preparing for this for a while. I think if you look at the infrastructure, the epidemic infrastructure in the country, including the number of ICU beds, the number of isolation beds that we can muster, the number of hospital beds that we have in the country at the moment, is such that we are fairly confident that we can be able to deal with an upsurge if it comes. Our prayer, of course, is that this does not happen. And as I keep repeating, the way it is not going to happen is to make sure as many of our people as possible are vaccinated. We obviously keep in constant touch with the World Health Organization, with the CDC, and as I was saying, in consultation. What we are talking about is things that we have done in consultation. The measures that we are announcing are in consultation with those institutions. We must understand that we don't live in isolation. We live in a global community. And when you look at the rest of the world, you can see also there are similar measures. Country to country are taking different measures depending on their own environment. For instance, there are countries that have now decided that they do not need masks at all in any of their spaces. Now, those countries, I think something like Denmark and Sweden, but those countries have got almost a 100% vaccination rate. So if our vaccination rate were to increase to those extents, then we would take further measures and reduce the mitigating measures that even we have maintained even today. So our hope is that as we move forward and as we increase our own vaccination rate, then further measures can be made. On the issue of Georgina, you're asking about vaccination of teenagers. As you know, I'm going to ask Dr. Amoth to respond to that particular question. But as you know, we have said repeatedly that the age 18 persons are the ones who we have said should be vaccinated. The rest are voluntary. The Pfizer vaccine has been certified for use even to amongst younger people. And there are countries that are vaccinating people as even 5 years old. So it's not abnormal to do so. However, I would take exception if indeed a 5-year-old has been vaccinated without the mother or the father's permission to do so. My only question would be, where was the mother when it was being done?
Thank you. In addition to what Waziri has said, is that vaccination is entirely a voluntary process. And for vaccination of teenagers in school, our cutoff point has been 15 years old, and parents are actually expected to be able to give consent. And that is why you have seen a substantial increase in numbers of children in schools being vaccinated. Other jurisdictions have lowered the age of vaccination to as low as even 5 years, as Waziri has told us. And as more information is gathered, you never know, in future we could even be able to have infancy vaccination. So as more evidence is gathered, science is informing us in the decisions we take. And it is taken for the overall protection of the entire society.
Maybe I was asking the 1 million, what are you going to schools, or what criteria are being used to vaccinate?
Multiple prong approach is being used, including approaching schools, approaching other social amenities where we can,
especially universities, secondary schools, where we can be able to get a large pool of students who qualify for vaccination. But of course, also those who are able to reach a health facility, if you come with your teenage son or daughter, 16, 17 years old, for vaccination, again, that service will be provided. But Waziri, maybe I can be able to take this opportunity also just to highlight about the yellow fever outbreak in Isiolo. Though no question has come regarding that. Yes, we are dealing with a situation in Isiolo. For us, because as the African continent, 34 counties in Africa are yellow fever prone, and another 14 in Central America and Southern American region. So we have reported so far 3 confirmed cases of yellow fever from 2 sub-counties in Isiolo. We have sent technical teams to be able to support the Isiolo County government in terms of case management, line listing, and community engagement, and of course in preparation for vaccination. There's a safe vaccine for yellow fever virus, which offers lifelong protection and takes effect after just about 1 month of vaccination. So yes, we are dealing with a situation, but it is under control, and there's no need for panic, because the epicenter of that outbreak is far-flung with a sparse population. So risk of human-to-human transmission, through mosquito bites, that like happens in urban settings, is unlikely. So it's likely that in the next few days, we'll be able to quash this outbreak. Thank you. I think the final one. Yes, Angela. I'll take 2 more. Yeah.
My name is Angela Okage. Now, as a country, we are basing our hope on vaccination because we've lifted several measures that we had put in place initially. But then, are you not afraid that lifting the mask issue is going to affect our vaccination uptake? And then, considering that now we are putting more emphasis on vaccination, what's our stock? What's our current stock?
Stocks.
Yes, stocks that we have. And what is it that you're going to do to increase the vaccination uptake?
Okay. Yes, Sarah, another one.
So,
final one.
So 2 years is a long time to fight any disease. I mean, we've been fighting HIV longer, but what lessons have you learned as a country in those 2 years, and which of those lessons are we going to keep for the health sector?
Okay, mine is to seek clarification. You have said, I'm Elizabeth Atieno from TV.
Yes, Elizabeth.
7. You have said no masks in public places, but people should wear face masks in public transport. If you could clarify on that, kindly.
Correct. First things, let's talk about the vaccination. And first, Angela, is to say that, you cannot keep people wearing masks because you want them to be vaccinated. You keep them wearing masks because you get sick if you don't wear a mask. So vaccination is voluntary, and people must be vaccinated on voluntary basis. We have said that it is a way to save families and a way to protect your own loved ones. However, we cannot vaccinate people by force. What we have said, and we will continue, and by the way, we have more than enough more than enough vaccines in our stores. In fact, our challenge at the moment is that we must increase the uptake so that we do not have vaccines expiring in our stores. And the only way to do so is what we have been doing. And I want to take this special opportunity to really thank the media. I want to thank the media in a very personal way, because in spite of the apathy that we observe in some places, the media continues to be in the forefront of risk communication and urging our people to be vaccinated. The radios, the FM radios, the print media, TV, we appreciate what you have been trying to do because we work together in this space. So it is the only way to do it. We will continue in the same space of further. We have also asked the provincial and county administrations, including county governments, to continue in this spirit of urging people to be vaccinated. And there is only so much that you can do, you know, short of marshalling people into centers to vaccinate them. I think Kenyans are educated enough, Kenyans are smart enough to appreciate that this is for their own good, and being vaccinated is a personal responsibility. On the issue of lessons that we have learned, it's a long story, Sarah, and perhaps when we have a whole day, we could talk about the lessons that we have learned. But I think there are a number of things that I can cite top of my head. The first one is that as a government, we must always work from a multi-agency perspective in these kind of situations. It is not the Ministry of Health alone that can conquer these challenges of epidemics. I think that a multi-agency approach, a whole government approach helps a great deal. Because as you remember, there is a question of curfews. The Ministry of Health does not have police to enforce curfews. This is an interior cooperation. There is an issue of closure of bars and restaurants and so on. This is the private sector. It is the community, and they suffer a great deal to adhere to what the Ministry of Health has said. So it is everybody, the interfaith, the religious organizations, the closure of churches and mosques. It's a very painful experience. Yet they do so, you know, if push comes to shove, and if that is the only thing that can save Kenyans' lives. And of course, finally, citizen responsibility. And for me, I have seen an increase in that consciousness of citizen responsibility. That's one. The second one, in terms of more so to do with public health, is just the role of hygiene. What we have picked up as a role of hygiene. Now, you know, there are nations in the world that pride themselves in being extremely clean. Singapore, for example, you know, talks about how clean they are. If you go to Rwanda, just neighboring here, is very, very clean. And now I have begun to see what I consider as clean counties. My visit to Kisumu, for example, last week, you know, showed an extremely improved hygiene standard in Kisumu County. And we have talked a great deal about the introduction of a cleanliness index, county-to-county competition in our country. What we have observed is that just hygiene measures and just being clean should be made a movement such that in a year or two down the road, we can also claim amongst the citizenry. And when we go out there, we can claim that Kenya is indeed a very clean country. This, of course, is going to take the effort of the government, because we must keep our cities clean. And when I say the government, I mean particularly the county governments, because cleanliness is essentially in the county government hands, as well as health officers and public officers, public health officers who are in those places. And what we are going to do from the lessons that we have learned, we are going to emphasize a little bit more on measures that perhaps had been relaxed in the past. For example, if you are going to have a meat-eating joint or a restaurant and a place where people are coming to eat, the standards that must be kept in those places must be high. And I mean even the sanitation areas. And I mean, you know, you and I know, it's not, nobody is going to hide facts about Kenya because they are there in the open. Sometimes you go to those places, you go to a food restaurant, ama pahali pa nyama choma, na unaomba Mungu ukule hiyo nyama na usiende show. Kwa sababu ukienda show, pahali wewe unakula hiyo nyama, ukienda show ile inatumika hapo, story itakuwa ingine. Itakuwa story ingine. Unajitayarisha kabisa. Mimi sitaenda kukojoa ama sitaenda show kwa sababu najua pahali naenda iko chafu sana. We cannot continue like that. Hiyo haiwezekani sasa. Kwenda mbele, kama wewe una pahali pako ambao unashomea watu nyama, ni lazima show inakuwa ni safi. Na ni lazima uwe na pahali pa kunawa mikono na njia inayofaa. We must respect the people who are eating in your joint as human beings. We must respect you must respect your customers. Ndio unakuwa na usafi ile inafaa yule mtu anakula kwako. You know, so these are some of the measures that we have to emphasize on and make it stiff. You know, we make it clear that there will be stiff penalties for not doing so. Because if you don't do that, then we as a government end up having to pay and buy medicine and put you in a hospital and all those things. So to me, that's some of the most significant lessons that we have learned. And finally is that prevention is always better than cure. If we can prevent diseases from happening, then it is so much cheaper for everybody across board. Prevention is better than cure. And moving forward, the Ministry of Health will emphasize a lot more on prevention and public health than or equally to how we have been emphasizing on cure. I think there has been too much emphasis on cure and very little emphasis on prevention. So we are going to treat prevention as an equal part of health management. Ya mwisho kabisa, if I may just add one more, I think somebody had asked about Mondana. Somebody mentioned about Mondana and the production of vaccines in our country. In fact, if I remember correctly, you said something about the fact that Mondana, because of Mondana and the virus, looks like is slowing down. Now remember, vaccines are not just made for one epidemic. Vaccines are made for many, many things and many diseases across our continent. And Africa, the African continent, makes only 1% of the vaccines that we use. 1%. So 99% of the vaccines that we use are manufactured and sold to Africans from outside the continent. That should tell you something. Kenya previously did not have a single human vaccine, manufacturing capacity. So for me, is to say that we are very, very excited about Moderna's decision to manufacture vaccines in our country. Moderna's investment in Kenya is a stamp of confidence in the attractive investment climate in Kenya. But furthermore, more than that, it's a game changer for the pharmaceutical manufacturing sector in the African continent. And not just the manufacturing sector, it's also a game changer in terms of the new technologies that are going to be used to face diseases and treat diseases into the future. And therefore, for Kenya, this is a really, really big deal. And we are very, very excited about it. Thank you very much. Sorry.